but hey, there you are.
Yes,
Um,
yes, yeah.
but he'll say, "Hey, Daddy, can we just get 5 minutes? Just 5 minutes." And when you hear a 3-year-old voice say that,
Oh, yeah.
it's kind of hard to just,
Yeah.
So flexibility, patience, but we're
Yes.
enjoying the time for the most part.
Right. I always get, I come home after because we're doing with all the pop-ups, we're pulling late nights,
Yeah.
and it doesn't even matter. I come home and I open the door. He's like, "Mommy, mommy, 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 mommy," and he does it. He does his dance, like it never stops, and it's just like
Turn up.
he every single time without fail, he'll break me down.
Yeah.
Whatever energy, attitude, whatever I came in with, it doesn't matter. He's gonna break it down.
We need that. I was on another session with Brenda Salgado. She is one of the authors of a mindfulness book, and
Oh,
she
yeah.
said that the kids are medicine right now for this time where we're just, we need to have a good reason to break away from the survival and hustle and bustle for those of us that are organizing and supporting other people. So they're blessings.
They sure are. They sure are. I remember our first pop-up, he came, of course, everyone's like, "Oh my God, self-distancing and protect your kids." And we're having this pop-up drive-through event. And here he is, 3.5-year-old, going at it with a very adult-sized basketball court. He was at it. And everyone was like, "Oh," it was like, well, this is the life we were trying to get back to, right?
Right. Just kicking it. That's beautiful. Speaking of your pop-ups, so if it's all right with you, we'll just jump right into it. I'm getting a call. Can you hear me?
I can hear you.
Can you hear me? Okay.
Yes.
I got a call as soon as I started to jump right into it. But so you all are doing pop-ups. If you could walk me through, you got myCovidMD, founded by 3 Black women doctors, and you're providing free rapid drive-through testing and telehealth services for marginalized communities. And you've already started doing these pop-ups. Where did this come from? We know that there's clearly a need, but how did you all come together in a time like this to do something so important?
I think we're still trying to figure out how it all happened because it happened so quickly. I think, for as far as myself and Brianna DeCure, we're both emergency medicine physicians, and we have been working in that space for a while. And when the COVID issue came up in our hospitals, it hit us with a brick, but we already knew it's like this calm before the storm. So we were starting to see cases. We started seeing, the administration rattling around, doing stuff that doesn't make sense. And then all of a sudden we were like, this is not normal. This is not business as usual. Something's coming and we don't know what it is. And then it hit. It was just like literally overnight. And then when I say it hit overnight from, if you're an ER doctor, there's a certain protocol that you follow because you never know what's going to come in the door. So you prepare yourself in a certain way to address any and all emergencies, right? And that protocol was being broken in so many different ways. And every 6 to 8 hours, we were changing protocols. And that's when you know that when there's chaos in a hospital setting, you can only imagine what's going to happen because you have to have something that's stable. And so when we started seeing the cases and the concerns about exposure and the access to resources for the hospital side, we realized that there is going to be a volume issue that's hitting the hospital. And the frontline individuals, whether it's just not even just the providers, the janitors couldn't turn around rooms fast enough. We weren't protecting, the service workers, the secretaries, the nurses. All the way down the supply chain. When you start thinking about everybody's involved, we're like, wait a minute, there's something going on here. And the reality is that the hospital is not the setting to funnel all these cases through because in of itself, it only has so much capacity, right?
Right.
And so once we immediately identify that this is a surge issue, this is a capacity issue, the illness of itself can be managed, but the capacity in which it's almost like trying to fix something in a square in a round peg, you just keep pushing and there's no way it's going to happen. We realize that if this is a community acquired infection, we need a community-based response. We need to get the response out of the hospital where it's constrained and into the community. And so being part of Shared Harvest Fund and our platform has always been community focused. We work with nonprofits and we match them with skills-based volunteers, and we underwrite those skills-based volunteers with debt relief, so student loan debt relief credits, because we've known a lot of people who have incredible skills are also drowning in debt. So we wanted to create this bridge. And so we built those relationships.
Stress is also something that can impact the immune system too. If you're really stressing about the bills and all the things you have to do.
Financial health, mental health and well-being, crisis, how do you deal with crisis? And if we're talking about, COVID being an immune conquering infection, you want to make sure your immune system is up and strong when we're all dealing with this. So, we did what we thought made sense. We started connecting with our nonprofit affiliates, and we said, if we can get more people tested, maybe we can quell some of that anxiety, quell some of that fear, and then get people mobilized. And so we just started anecdotally finding where the need was. And then we expanded to, well, we can pop up, like there's pop-up shops for dress stores and this and that. Why can't we pop up and just start testing people? And literally that's what we did. And then we started realizing, especially because we were still working in the emergency department, and believe it or not, being able to be in the community strengthened me, informed me for being in the hospital, right? So before it was this helplessness of, gosh, there's so much going on, we can't even handle it, to, oh, okay, if we can just get the community more involved in this way, that would help out the hospital too. It's just like a no-brainer here, And so we even got nurses going out in the community with us. We've got directors going out in the community with us. We created an entire infrastructure, because just imagine it, we're decentralizing the testing, right? So those are healthy or not so healthy or not blending together at the hospital, right? We deal with the most sickest patient at the hospital, where we can, narrow down the volume. But in the community, everyone gets informed, giving us access, and then other people can turn around, become volunteers, and help each other. We just activate the best part of our community. And so it was really organic, but it was a beautiful thing, because since then, we've had several pop-ups. We're still a small shop. We could, 3 women founders. We're not, huge funded by the state or by some celebrity. It's just grassroots, how we're doing it. But love it.
I love that. And I love how some of the best work just really comes out of an organic need for whatever it is that we're doing. What does a pop-up look like? And I imagine that you're getting some information from people who are experiencing different levels of illnesses, different levels of constraints, different circumstances. So what does a pop-up look like, and how is your interaction with people on the ground informing your approach?
Yes, great question. So our pop-ups we started with a cap of 100 people. It's basically a drive-through. If you ever on the West Coast, and if you ever visit In-N-Out Burger, the West, if you could imagine that drive-through, In-N-Out is known for having the most ridiculous drive-through line of assembly, but it is a well-oiled engine, from when you order to when you get your food to when you exit. And that's really the model that we were creating, is basically everyone stays in their car. They register through their Eventbrite. When they arrive there, there's a registration booth to confirm that they're registered. If they're not registered, we take only a certain segment of registered people. And then they start along the line. The first person that they hit is the telemedicine provider, which is on an iPad screen. That person is doing an assessment, almost like a drive-through monitor. Instead of taking your order, they're doing your assessment, how you're feeling, what's going on. And then a nurse is by there. we do air vitals. So we're able to get the, sorry about that, I think I told me. We're able to get their pulse, they're able to get their oxygen saturation, their heart rate, and their temperature.
Through the air?
Well, through our devices that we use. So one is an air temperature, is use infrared, and we can measure your temperature.
Really?
Without even
This
touching
sounds like
you.
some
Yeah.
Star Trek. This sounds like something off of Star Trek. Voyager. I saw it.
Yeah. Well, you know, we had to incorporate technology and, you know, all of those beautiful things. So we get their vitals, and then they move on to the test. We do serology test, which is not the swab test, so you don't have to worry about inducing aerosolization or getting people extra infected. We're all in PPE gown, you know, so this is a full protective gear for all of our volunteers. And we do, our samples are similar to a finger prick. So those of you who are familiar with diabetes and how you check your glucose, that's the amount of sample that we do in serology. And then our test goes right into a makeshift lab that we created on site that is protected, is OSHA cleared. And 30 minutes, we get the test results in 30 minutes. And people just go at the end of the line. You exit with a gift bag of goodies about what's going on in terms of COVID. What are your resources? A rose. Sometimes you get a bag of groceries. Yeah, and it's all in the backdrop of some really great sounding DJ music in the background.
What? Y'all got some music out there? This is a party. We kicking it.
We're taking care of each other. So one of the things that myCovidMD's drive-through testing is like no other of the drive-through testings out there, because we put the human touch to it. We're speaking to our culture and our community in a way that matters. We're not telling them they need to get testing. We're bringing testing opportunities to them. We are still sharing the space of love and energy and ease to reduce anxiety. Most importantly, it's not just about the test. So everyone that's a part of our drive-through or our pop-ups are a part of our telemedicine program. So if anyone needs mental health services, wellness services, if you need, we set you up with a crisis buddy. Someone's just going to call you, check in on you. And then all the test results, no matter what, if you're positive or negative, you get a follow-up, a 4-day follow-up and a 7-day follow-up.
So with your assessments, do you, when you have your intake, is that the time where you learn about what other needs someone is experiencing, whether it's mental health?
No, because that is specifically the assessment to see if you are high risk or low risk of having exposure to coronavirus. Where we get that more intake is when they get the test results, because even though we get the test results back in 30 minutes, we hold off till the end of the day to reach out to individuals. So those who are positive get a follow-up with our health providers, and that's when we find out what other additional resources they may need. And then the negative ones, or within 24 hours, they are connected with a community health partner.
Oh, I see. Okay. Yeah. So it's this collaboration that also allows you to learn about what the other needs are and provide the other needs. So it's not like you got 3 super women. I mean, you're definitely super women, but it's not like you're running around at the speed of light doing all of the pieces. You're working with organizations that do some of the things that you either don't have the time to do or that you're just not focusing on. Hey there, what's
you
up?
See little man, the boss man back there?
You're like, what's going on? What's going on back here?
So absolutely, to your point, because we know, working in the community for as long as we have, that we don't have to reinvent the wheel. There are amazing organizations out there doing impactful work and know what they're doing. In fact, I mean, if nothing else, this time period is a testament of how little we support organizations who know what they're doing. You know, if those organizations had the resources that they could to leverage, they would be fully in full 100% functionality at this point.
Right.
And that is, from the hospital standpoint, that's exactly where I see, you know, the disconnect, because it's the social services are a heightened. There's a lot of numbers about African Americans being most affected by the COVID crisis. And it has everything to do with the breakdown of social services. So for example, if you are an older woman or a grandmother who depends and relies on your family to make sure that your oxygen is on at night, you know, or if you live in a nursing home and you need somebody to make sure your oxygen is okay at night. And then all of a sudden the nursing home has less people because of the quarantine. You don't have your family visiting you. And then all of a sudden you're left on your own. Are you going to go through these points where your baseline chronic disease has gotten worse? And that's what we're seeing. Those with baseline chronic disease, whether it's asthma, COPD, sarcoid, these are really rampant about in the African American community. So we're seeing the exacerbation of those diseases alongside with COVID.
And so when it comes to working with people, and you know, I find it amazing. I can have the calmest morning with 0 calls, and as soon as I want to jump on a Zoom call, we're getting blown up. Right. Like, I'm ready, y'all. I got my phone. So when it comes to reaching people who are, because I know a lot of the problem is that there's also this lack of access, whether it's, you know, we're just not, as a community of Black folks, in the habit of going to the hospital or going to the doctor, or, you know, for whatever reason, we just don't feel like that. It's not resonating with us. There's this lack of access. And at least here in Madison, there's also this issue around the connection to the people. So for service organizations, they're like, yeah, we have this great service, you know, so they say, but their connection and a relationship with people who are most impacted or the most marginalized population, it's just really not there. It's not, and if it is there, it's kind of fleeting, you know, and people aren't necessarily having a family experience, the kind of family experience that they're getting when they go to one of your pop-ups. So how are you, of course, we know that it's a different geography and different demographics in your state, but how are you connecting to the people? How are you reaching people? How are you getting the word out, you know?
Yeah, no, you bring a lot of great points, because what you're talking about, social determinants of health, we're talking about cultural competency in the healthcare system. We're talking about healthcare inequity and the reality that, especially for the African-American community, there's been a lot of distrust around the healthcare system because of previous long-standing history. I mean, we always mention the Tuskegee, but there's so much more.
Right.
And so, you know, some of my colleagues and I have had this conversation, you know, it's very hard to go from the me to the we if those in the we have been feeling isolated for a long, long time. It's like, what do you mean we? You know, there's some people, you know, you go to urban communities and they're not wearing masks and they're out and about, and, you know, it's passing all this judgment. Don't they know? Don't they this? And you're like, well, actually, they know a lot, you know, about survival, because there's been a lot of other issues non-COVID that have not been addressed. And so when you're weighing what's the worst case scenario in your life right now, you know, we have to come at people differently. We always say this, and I say this as a clinician, as a healthcare worker in public health, you got to meet people where they are in order to get to the same place together. Right? You just can't, you can't come up with laws, you can't come up with policies, you can't come curfews, you can't bring the National Guard in because they're not listening. You know, all of those things do nothing else but pull communities and cultures away, and make them believe more into what we call the fallacies and the myths that already exist, that are out there. But the truth is, one of the greatest gains that we've had in the 21st century is the number of women and people of color that are in the medical field now is huge. And so having those individuals be part of the dialogue of how do you get into communities? How do you build trust so that this doesn't happen in a way that seems so isolating? And especially in a condition, especially this, right? Where we're not, I use the term, we should self-distance, but not, we're physically distant, but not socially isolate.
Yeah.
Because it's true. Because if you don't know and you're fully isolated, all you're going to believe in what you know. You only know what you know.
So one of the things, speaking of what we know, you only know what you know. And we are kind of, as a community, like you said, struggling to just, maintain in general. And then we got, COVID dropping on top of that, exacerbating pre-existing conditions, et cetera, et cetera.
Exactly.
But then, we have a new type of conversation to have, and we're at we have different perspectives within our crews. So for me, I've got brothers and family that are like, don't, y'all scared, y'all giving in to the fear mongering. This is a conspiracy, 5G, all of this stuff. I'm not quarantined. And then you got my mothers, church mothers, who I love dearly.
Yes, yes.
And they are, with the spirit of the Holy Ghost, going to church and convening and, still laying hands on each other and all of this stuff. And I get it, but, I don't know what to say to mother so-and-so. You know what I mean? But I ain't go, what I'm gonna do? Be like, hey, mother, I can't shake my finger at her. So I think that there's navigating those conversations. And I imagine the people that are showing up with you kind of already have a baseline, like, I know this is an important thing and I got to do something about this. I'm going to go get tested and figure out what I need. But do you have any insight on bridging the gap for folks who might be further along or not necessarily with the times and seeing this as an issue?
Yeah, I think it starts with simple human kindness. Everybody wants to be heard, no matter who they are, where they're coming from. Even ourselves, right? As doctors, we want to be heard. We want our patients to listen to us and our advice, right?
Right.
Their patients are coming, they want to be heard. They have an illness, they have an idea of why they're ill, right? The person who believes in the conspiracy theory wants to be heard. There's a reason why they believe in that conspiracy theory. So with Shared Harvest, we have something called, very simple, it's a COVID kiss. And it's funny because you're not supposed to be kissing, but this is the kiss that you want. One is K, keep calm, and wash your hands. That's a fact. We go with the facts. Washing your hands will help you stay clean. Keeping calm will reduce your immune system, reduce the impact that stress brings on your immune system. Those are facts, right? I is, if you're sick, self-distance, not isolate. If you're sick, keep to yourself, right? Simple facts, we know that. S is show kindness. If you're listening to somebody, they're gonna, their level of calmness, what you're gonna understand about why they're doing or not doing what you think they should be doing, you become more informed just with listening. And sometimes for me, I've seen it all the time. I just have to keep my mouth shut, and most of the patients come to their own conclusions just by the silence. They'll work themselves right into their rational reason, right? And because they've given the space to help them work through what makes sense and what doesn't make sense for them, right?
Okay.
And then the most important thing is we have to be honest with ourselves about what are the facts. So we say share facts, not fiction, because we think we know what the facts are. But first of all, we are way early in this disease process to know exactly what's going on. We haven't even tested. We haven't even tested a 10th of the people who need to be tested. So we are going ahead with our own propaganda in some sense, our own reassurances. So we have to be honest that we don't know everything, right? And so when you're honest, then you start having a conversation about what we do know, right?
Yeah.
We do know that this is a community-acquired illness. We do know that right now it's droplet, not air, in the air. If it was in the air, we would have more deaths going on. That's simple as fact, right? Yeah. And we do know that testing helps inform us what we need to do. We also do know isolating people have consequences. And so as much as we can help minimize the threat of isolation to mental health, to access to resources, focus on what we do know. And then as we evolve together, learning about things, bridging who has what with somebody who has a need, then we get to learn more, then we get to do more, and then we get to be more together. And that's keep it simple.
Right on. I like that. COVID kiss.
Yes.
Gotta be careful who I say that to.
I know.
But it sounds. Hey, I like it. It sounds right. Speaking of working in community, you know, you're doing some of that, right? You're keeping it simple. You're sharing that space. You're learning and growing. I want to talk a little bit about the organizing part of this. You all are some amazing women who have done some really important things, and I can only imagine the lives that you have saved just in your practice, but now you're organizing and creating this resource that's, you know, we really need this right now. But I can imagine that some of that has come with trials. You know, people get stressed. I'm sure there's been some discussions, some, you know, tensions, especially if you're moving a mile a minute and the need is so great. Do you have any insights for folks who are trying to organize collaborative solutions right now, and you know, there's strong need, we got to do this right now, and then there's like, but we got to do it right, and we got to make sure that, you know, we're not causing harm. I can imagine you've gone through some of that. What do you have to share for people who want to organize now?
Definitely, to your point, I thank you for raising it. You know, organizing is an art, and we have a beautiful history of that, and we shouldn't take that for granted. You know, everyone, you know, assumes we just turned up yesterday with this, but this is something, you know, I have been an organizer, community organizer for over 15 years in different aspects and spaces. And it's because of that relationship that I have in different, whether it's healthcare, whether it's education, those kind of experiences and relationships have built to allow me to inform me in this space today, right now, so we can move at the pace that we are. So we aren't starting from scratch. You know, I am looking to those leaders who have been doing this. And I said, hey, this is how I want to connect with the community. I know you know your constituents. What does this look like for you? How does it, and being flexible with your idea, you know? For us, for example, you know, when we first started, we were just coming out the box. We were like, okay, let's do this. They need the tests, they need the support services, and we know this area doesn't have this kind of services, right? So let's do that. Let's connect with the right people. Whereas we've seen people who want to collaborate with us, but they coming in not even talking to the community, not talking to the leaders on the ground, you know? And whether you like politics or not, you have to respect the culture of which you are going to be a part of. There are some written and unwritten rules. So I think with community organizing, it can be frustrating because you have what you believe to be the goal. And so if you have your roadmap, you know, you see adversaries or people are trying to get in the way of you doing what you need to do. But just like in building a business, all of those experiences is part of the growth process of making, sustaining whatever else you are building. Because at the end of the day, you don't want it to be a one-hit thing when you're talking about the community. There's so many things about our community gets exploited day after day after day. It is scary that this is so huge, but it's scarier to do something and cause harm. So just like in my medical world, we say first do no harm. And starting to do no harm starts with hurry up and wait. So that's where they listen. Yeah.
I really feel that. And something that you said about this perspective around, you know, these challenges are a part of the journey. They're a part of our road to the thing that we are creating, that we are building. Sometimes we may see that destination really clearly, which I think can be a gift and a curse. If it's too clear, then we're not able to be flexible with how we get there.
Exactly.
But I also think that there's a blessing in the perspective that, oh, this is challenging. I don't like this, but it's so good that I'm experiencing this because it's preparing me for what it is that we're going to have to go through. So when that pop-up thing doesn't go exactly the way that we wanted it to go, great, because now we know how to make sure this other one does what it needs to do. And I feel like that has been really helpful, at least for me as a community organizer and as an activist, that these challenges are challenges, and sometimes they're really, really challenging, and we wish we weren't going through them.
Yeah.
But kind of that keep calm for me, what helps me keep calm is accepting that this is a part of it and necessary for me to get there. So it almost turns the challenge into what would have been a barrier. It turns it into an asset. It turns it into a benefit that I now get to carry on with this having overcome this thing, which I almost could be a good way for me, at least, to look at how we're experiencing this challenge right now as a community and as a globe, where we're going through something that's tough, but is there a part of it that's making us better? Are we paying more attention to our hygiene now? Some people, you know, they go into the bathroom and come out, you didn't hear nothing. You know, it's different now. Now it has a deeper implication. You know what I mean? Now everybody covering their mouth when they cough. You know, it's not, ain't no, if people take offense now. You're like, oh, you ain't gonna, what's up? You don't care about me? You ain't gonna cover your mouth, bro? Like, don't you care?
Exactly.
Care about it? So, you know, and I know that there's more to that too, around, you know, you're being connected to people, being able to overcome some of the challenges with the people that you're spending time with, you know. So I really resonate with that idea of just, this is challenging, but it's benefiting us. Do you have any challenges that you're able to speak about that, you know, have come up? I'm totally putting you on the spot, but anything that's come up with this, or you're organizing this, that has benefited you?
I mean, you know, I think one of the very honest truths about organizing is funding, right? So especially as, you know, being female founders, being professionals, you know, there is this facade that, oh, they're good. They got funding, people know them, you know, they're good. And we're just like everybody else, you know. We were shocked that we hadn't received any government grant funding. We didn't get any of that emergency money. We didn't get that, you know, staffing money. And we're right in the center of what is happening, right?
Yeah.
And the thing I will speak to is, and I've always said this because, you know, before I was a physician, I was Nana. I was Il Nana. I was I was in the community, you know, and I think that we underestimate just how smart and brilliant our organizers are, and how we need to make more room. Legislators, people who have power, need to make more room to hear those people who don't have the power. Because if we would all just humble ourselves to allow for room, we would probably get a lot further faster together. And so for me, what's been challenging is that, you know, we've come across people who want to ride the coattails. They're like, oh, you know, female, women, Black founders doing their thing. This is great. I'm going to take a, you know, shot, and let me write about you. Let me do this. And they don't fund anything. They're not doing anything. And more worse than that is, or they'll try to, you know, bring us through their thrones and kind of redirect our mission. And like, look, you know, our mission is very clear. We are serving those who are uninsured or underinsured, period. We're out here to provide a free service. In order to provide that free service for those who don't have it, those who have it are going to have to come out with a little bit of money. So yes, that's how our thing works. We're not here for the short run. We're doing the long game. The short call is the testing. The long game is what you do after you get tested. How do you rebuild our communities? How do we make sure the healthcare safety net is no longer just a net, and just build real infrastructure around healthcare in the community?
I like that.
You know, how do we not reinvent the wheel just because we just showed up? How do we make sure those who've been here are sustained in a way that's more meaningful and impactful for the long haul? So asking those real critical questions and forcing our legislators to ask those questions and forcing, frankly, older legislation and to get out of the way and let the young people lead and redefine how they want their world to look like. I think that's the bold move.
Yeah. Right on.
So
young people, stay woke.
Yeah, please, it's your time. We're just here to help you.
I love it.
Yeah,
I love it. And I think that, so when you are, as you're organizing, your model right now is pay what you can.
mm-hmm.
Okay. And then people who your costs average, and but I imagine that you have an average cost of what it is that it costs you to serve your individuals. And
Mm-hmm.
you have a goal for how many folks you want to serve. I think you said 100 or so that you capped it at. Is that where you're at right now for your pop-ups?
Blown away. I was like, truth and transparency is everything. Our pop-ups started at 15 grand. And when we were flying under the radar with the test and no one was using the same test we were using, so we kept our costs low and we were getting the supply. It was great. Everything was free and we were just hustling. Our team, our excellent, phenomenal team of grant writers were just writing and asking for private donations, and private angel investors were just amazing. And that was good. But then all of a sudden they're like, oh, what they're doing. Oh, that looks good. Oh, let's try to do this too. Oh, and the next, the cost goes up, and the testing that we're doing now, it's been talked about in New York Times. Everyone's talking about our test now. And so, of course, something that was $17 from $32 is now $92. So what does that mean, right? And squeezing out, there's, universities are doing research on it now, and again, everything, the hype around it, but we're trying to be razor focused and get it into the community. And it gets harder and harder when other people are now interested, right? And the other people with resources. And so to the extent that, the community has to understand that we're here, we're going to fight the good fight, we're going to do our best, but we can't do it alone. Obama said it the same. You can vote with me, but I can't do it alone. We got to do it together. And so that's what the same thing. We built this for us, by us, to serve the community that's not being addressed by the COVID-19 crisis, but we can't do it alone.
How do people support you? I know you got volunteer, you got donations, you got people showing up and actually paying what they can and not, trying to get that young discount. How do people support you?
So we have a GoFundMe page right now, myCovidMD GoFundMe page. All that money goes directly to buying the kits so that we don't have to negotiate kits anymore. We can just pop up. The way you also support us as well is if you host any of these pop-ups yourself, or help us find locations that will donate their facility, their parking lots, whether it's a church, co-working spaces, garages, people who own businesses if they want us to work outside of it. And then expand our ground game team, because we need every pop-up requires about 20 volunteers. So you can volunteer on COVIDMD.org. And we do remote volunteers and live volunteers. So if you're a provider, a medical provider, and want to do telemedicine through us, you can sign up as a volunteer to do that. If you're somewhere local and you just want to show up and help guide traffic, that can help. Everything helps. One thing I forgot to mention is that you spoke to, how to sustain people afterwards. So we were very mindful about that. And so our volunteer program exists in the same vein as our shared harvest platform. So all of our volunteers get a stipend towards their student loans, or if you don't have student loans, they get a stipend towards an emergency savings account that they have to hold for 6 months. Nice. So the idea is that we want more people to have those emergency savings for emergency rainy days, just like this, where the average American can't even have $400 put aside.
Well, if that ain't a volunteer incentive, I don't know what is. I was thinking about it, but now I'm like, well, we might need to go ahead and do that.
And you can, and we're, like I said, this is for us, by us. So there's things that you think we can do better. We had one volunteer came And she just was the most organized guru I've ever met in my life. And
I
we
love it.
snatched her quick fast. She is now she is now our volunteer manager. She is a beast and I love her. And we would never know. She just came in with her heart, what you say, our heart work. And she came and she showed up and she kept showing up and we gave her a job. As simple as that.
Nice.
Yeah.
So when as people are popping up, does it matter what city they're in across the US? Is it just in the US? Is it if I see one down the street, can I do one, on the other street?
So the way that works is that right now we're mostly in Los Angeles. We're moving out, expanding out to Detroit, where it's hit hard, New York, and Houston. But we have a model, we have a playbook. So if you have enough of a ground game, we can usually set up the first two and then have the ground team, go ahead and continue to do that. We source the resources and everything you need, the full protective gear and the medications. And because of our telemedicine platform is national, we can be anywhere. So to that extent, the key thing is having the right people on the ground to be able to run it.
Okay.
Yeah.
There is, I recently learned about a telehealth group in Milwaukee that you may want to connect with, because they are, I don't know how far along they are. They were a part of a collaborative grant to the university here. But I believe that they're doing some telehealth services focusing on marginalized communities. It's an all-Black practitioner out of Milwaukee. I'm gonna get the name and message you or email it to you. But things like that, it sounds like folks, but people don't need to be health practitioners to put this on.
No.
They can just.
Exactly.
Okay.
Yeah, we vet and make sure the clinical, out of the 20 volunteers that are working at one event, probably about 6 of them have to be clinical operated, and then that's it. So just to give you a context of how much of a lift it is. Telemedicine providers, absolutely, they need to be, full-on physicians, and that's why we want to build a network. Our greatest partner right now is Emerge Telemedicine, that's based out in Chicago. But we are always open to expand that network because, again, we want to anchor these resources for people who don't have access.
Word. Okay. This is really, really beautiful to hear. And I'm like, it's just amazing that you all have been able to organize so quickly and to have such a great impact. And the things that you're learning, I want to continue to be able to glean from that, because there are just so many people that are organizing right now and they're just coming at it out of urgency, which is, it's a fire, and it does motivate you to do something, which is great. But there's so many people that are inventing the wheel, or at least trying to, and they could work so much easier if they had a blueprint or we're able to see some good examples. So I'm really thankful that you all are doing that. Anything that, if you could speak to people who want to make a difference right now, before we jump on, I don't want to take up all your time. We've been on for close to an hour now. What would you share to people who just want to make a difference right now?
If you want to make a difference right now, just reach out, non-touching, to one other person and just acknowledge who they are. And it's not your friend. I mean, I'll give you a great example. After one of our pop-ups, I was exhausted. And there was a pizza joint, and I rarely eat pizza, but I was like, okay, I'm going to go get me some pizza. I get in this pizza joint, and there's one woman and her son ahead of me, and I'm just tired. And she turns around and she says, "Are you okay?" And I was like, "Yeah, I'm okay, thank you." And I got the face, and I'm okay. And she said, "No, are you okay?" And she's like, "I know that I never get a chance to even ask people, how are you okay, and actually get to listen to the answer. So I just wanted to ask you if you were okay and if you weren't." And then I was like, well, if you really want to listen, and I started telling her about what's going on. And I was honest, and I just told her what's going on. Turns out, long story short, she was a banker, and she loved what we were doing and had heard about us, and but that bridged a relationship that would have never happened, and never happened had we just not acknowledged each other in a line and pizza. And that's what I mean for all of us. This is a beautiful time to reset how we build relationships with our neighbors, with people we know, people we don't know, in a way that can be meaningful and not just what you got for me, and go forward, and just starting with, are you okay? I just thought that was, for me, as COVIDMD, that lesson of this COVID crisis was just checking on people and finding out if they're just okay.
Yeah.
Maybe somebody can make a T-shirt on it.
Yeah, right. Are you okay?
And laughter. Laughter is also good.
Right. Well, listen, I'm so glad to have been able to laugh with you and to learn about the work that you all are doing. Phenomenal, important. And, I feel as though this is, I don't want to say this is only the beginning in like an ominous way. I feel like this is only the beginning in terms of just your impact and where you all are going with this. And I believe that people experiencing this session now are getting something from it. And I hope that we can talk again soon to see where you're at, what you're doing, and how else people can get in tune. Real quick before we go, how do folks reach you again? How do folks contribute and get involved?
So on the GoFundMe page, myCovidMD, that's the name for GoFundMe. If you go to covidmd.org, you'll be able to either donate to your city if you want to, or do the general In This Together donation fund. And then all of follow us on Instagram. This Friday, we're having a special pop-up for all of our female founders, businesswomen, creatives, caretakers. We acknowledge those who are struggling in their businesses. So we're giving free testing and telehealth services. If you're a female founder in Los Angeles, stop by our site. You'll see, log on Eventbrite, special tribute. We got some special music, some special gifts, as you know how we do it. So we're testing and then some. And then, and then one of our sister partners are doing something in Queens as well, on Monday and Tuesday at York College. So if you're in the Queens area and you want to get testing, you go check out our sister partners over there as well. So yeah.
Lovely.
So thank you. And thanks for the platform. Thanks for what you're doing. It's so nice to have so many new faces that are really getting our message out there and expanding our network and our community. So I really appreciate the love that you do and make this happen.
Thank you so much. It's all love. We're out here because this is what we do. So soul to soul, appreciate you. Thank you so much.
Thank you.
And we will definitely be in contact again.
Awesome. You take care. Wash your hands.
Most definitely. I feel like I gotta wash my hands now.
All right.
All right.
All right. Bye-bye.
Bye-bye.